Welcome to the award-winning SuperHuman Academy podcast, where we interview extraordinary people to give you the skills and strategies to overcome the impossible. And now, here's your host, Jonathan Levi.
Before we get started, I want to ask you a question. Do you think that you are getting enough whole foods and nutrients in your diet? Chances are you probably aren't. Look, it's not your fault. First off, it is expensive and time-consuming, and it's a huge hassle to do all the cooking and all the preparation. But also, we know that our foods today, no matter how much we eat our veg, our topsoil is depleted and there is not enough rich nutrients in our food. And that's why I'm so excited about Ambro Greens, the latest product from one of my favorite nutritional companies out there, Ambronite. Ambro Greens makes it really, really easy to get all of your nutritional bases covered with just 1 teaspoon in cold water. The product tastes great. It gives you tons of additional energy, improves your digestion and gut health, and can even boost your immunity. Now, I have been having this in the morning, and as you can tell, I have a lot more energy. So I've partnered with the folks at Ambronite to give you an awesome deal if you want to try out Ambro Greens. All you have to do is visit ambronite.com/superhuman. That's AMBRONITE.com/superhuman, and you can try the product out for just $9.90. So go ahead and visit that link to try out Ambro Greens today. This week's episode, which is lovingly crafted thanks to a pretty funny review from T7P7 in the United Kingdom, who says, really great content. Would be so much better if Jonathan cut down his wows. Well, I want to tell you that I've been working on it ever since I read this review. I really do appreciate the feedback. I didn't know how much I said wow, but you are absolutely right, and I am working on it. So thank you very much, T7P7. I do love some good constructive criticism. On to today's episode, which is hopefully mostly wow-free. Today, I had the pleasure of chatting with Dr. Bertalan Mesko, a PhD, the medical futurist, and the director of the Medical Futurist Institute, which analyzes how science fiction technologies can become a reality in medicine and healthcare. He's a geek physician, his words, not mine, with a PhD in genomics, a top 100 author on Amazon, a private professor at Semmelweis Medical School, and much, much more. Let me tell you, I really enjoyed this conversation, and I learned a lot about what is actually standing in the way of making us literally superhuman using technology. And the answer will actually surprise you. I learned about what we can do to advance the agenda of using technology to improve human lives, and I just had a really interesting conversation about all the different ways that technology is already improving our health. If you listen to this episode for no other reason than for the list of devices and hacks that Dr. Mesko uses in his own life to measure everything from his sleep to his happiness and beyond, it will have been well worth your time. So I know you're going to enjoy the podcast episode. Here is Dr. Bertalan Mesko. Mr. Bertalan Mesko, how are you, my friend?
I'm really feeling quite well. Thank you so much for asking. How are you?
Yeah, I'm doing pretty well. I had a really interesting meeting that prepared me for this interview today. I met with the founders of SuperMeat, which is a cellular ag company doing, cellular kind of all kinds of crazy technologies for tissue engineering. And I feel like that prepared me for all the medical futurism we're going to talk about today.
Wow, then I really look forward to it.
Awesome. So, Bertalan, tell us a bit about who you are, what you do, and what's really interesting and what I couldn't cover on the intro by myself, how you got to be the medical futurist.
Oh, wow. At the age of 6, I fell in love with the scientific method. So then, that time I knew exactly that I wanted to devote my whole life to doing research and science. And that's why I went to medical school and I finished my PhD in clinical genomics because I wanted to be a geneticist, precisely. And when it happened, I was 26 at the time, I felt that something was missing from my life. And that thing was me being a geek, living all my life with technologies and through technologies and by technologies, and somehow that's missing from a researcher's life when you do research in genetics. And what I found out was that I had to somehow mix two branches of science together. One is life sciences, and the other was futuristic studies, which is under social sciences, which I haven't even found an example for, or a model for, that someone would have done it already. Therefore, I had to start this journey on my own, and that's how I became the medical futurist. Now even the Academy of Sciences in my country, in Hungary, acknowledges this job title, or subfield of science, the medical futurism. And that was the time about 8 years ago when I started building a team around myself, so we can help people get the context around changes due to medical technologies, and to understand better how artificial intelligence, the use of health sensors, or augmented reality could change healthcare for the better, and how we can prepare for that. So then I have a team of 12 people in the medical futurist, where we communicate to about 500,000 people worldwide, and we work with governments and medical organizations to get something out of these technological changes, and to help them understand that digital health is a cultural transformation just initiated but not driven by technologies. And also I launched the Medical Futurist Institute, where we do the same but in peer-reviewed research. So very shortly, that's how I became the medical futurist.
Wow, that's a lot to unpack, and it's incredible. And and I almost tongue-in-cheek asked, how do you become the medical futurist? And I love that the answer came back, well, you kind of create something new that hasn't been created, and you merge. I have a theory that all creativity and all genius comes from combining existing things in new, unique, and novel ways. And it sounds like that's exactly what you did, mating technology with medicine.
What can you do when you can't put yourself in a box that everyone knows? And you know that even if you could do that, you would not be content for your entire life. You would not really be satisfied by your job. And as a researcher, I have responsibility for the people we do the research for, but also at the same time, I have to make sure that I keep myself inspired and motivated for 70 years from now. I shoot for living until 100 and boarding a spaceship to Mars then on my own legs. And for that, I have to make sure that I enjoy what I do literally every day.
Wow. So I have a million different questions, and I certainly feel like just to sit quietly in the corner of your office for a day would blow the average human being's mind as to just what kind of technologies are coming down the pipeline for us. But I guess what I would like to ask is, what are you most excited about right now that you are seeing in the technologies you're working with? I would limit the question and say with regards to helping us become superhuman, given that's the title of the podcast. But I think it's probably the case that almost everything that comes across your desk involves in some way improving the human experience.
For me, far the most exciting thing these days is not a particular technology or trend, but a direction that these technologies make patients the point of care. And while I know this sentence doesn't sound like an attractive and sexy sentence focusing on technologies, but this is simply the biggest milestone in the history of medicine, that we patients will not be just an element in the healthcare system, and then we have to ask someone to let us into the ivory tower of medicine to get help, and that they tell us what to do, and then we go home, and whether we comply with that or not is our decision. But that has been the role of being a patient for 2,000 years since Hippocrates. But what's changing now in the 21st century due to accessible, really advanced technologies is that we are becoming the point of care. Where I am, I can get diagnosis, I can get treatments in a customized, in a augmented way, and I can use all my data to make better decisions with my caregivers and medical professionals. So that notion that I have a freedom of choice, that I can obtain data in the same way as only medical professionals could within the ivory tower of medicine, again for 2,000 years. I think this is simply exciting that we have a new player in this board game that we call healthcare. And I also firmly believe that this is patients are the best resources we could ever hope for to get as a new player in this game. So every rule, every model, every strategy that we have had for 2000 years now have to change because of that, and it makes me really excited for the future.
I completely agree with you. I think it's so empowering, and that's a word that I use a lot. It's so empowering when a person can measure their own sleep. They can buy a device, albeit we're still in the primitive stages, a device that can measure their own brain waves, and they can send out for their own labs and get their own microbiome tested. It's so empowering to come to that conversation educated and informed.
Absolutely. And that's why for the last maybe decade or so, I've been trying to become the patient from the future without having any symptoms or diagnosis. But I've been trying to live like someone would live, and normal person would live in 5 or 10 years from now. And I tried everything that's on the market as a physician, as a patient, to be able to tell other people how these work and what the challenges and the benefits are. So I had my genome sequenced, I had my microbiome sequenced. I've been tracking my sleep for more than 10 years now. I use a smart sleep alarm, so I know when to wake up at the best time from light sleep, not deep sleep. I've been tracking my exercises, and I make myself exercise for 30 minutes on average per day. But I've been tracking my cognitive health, my emotional health, my physical health all together. I've been trying to put on some good habits. So yeah, this is empowering. Also, it comes with a good dose of anxiety.
Yes.
When you're about to receive your genetic testing report, you know that you might receive some data, some results that make you uncomfortable and make you worried about the future. But that's why you have a freedom of choice, and you can choose if you want to know, for example, your risk for Alzheimer's disease or Huntington's disease. This is your choice still. But I believe in the other side of the story, that with more data, I have a better chance, and simply I have a better chance for a longer and healthier life. So as medicine is not linear, even if they could measure everything about you and around you, your vital signs and health parameters, and do a body MRI and PET scans, everything we want to, we would still not be able to provide you with the world's most perfect report about what might happen to your health in the next decades or so, because that's not how it works. Therefore, even just imagine how much effort and time and money I've had to put into this to become the sort of patient from the future. And the only thing I've gained is just maybe a bit higher chance for living a longer and healthy life.
Mm-hmm. Now, you talked about this idea of how we all can be so much more informed and involved in our healthcare and in our health. And I want to ask, do you feel that now puts not a burden, but a responsibility on your average person? I'll give you an example. I personally believe that in order to vote in a country, you should demonstrate that you understand the laws and history of that country, that you're making informed decisions. Is it the case that the patient of the future is really we're going to have to expect that they have a basic competence, a basic understanding of the human body, of their health, of the options before them, in a way that they maybe didn't in yesteryear when you'd go into the doctor and do whatever the doctor said?
It's an amazing issue. It's a very important question. I believe in the importance of the freedom of choice. So if you're a patient who wants to remain the same as you have been behaving in healthcare, that you are a passive component, and when you have a symptom or disease, then you go for help, and then medical professionals tell you what to do. If you are fine with that model, you should have the choice to keep on living that way. But actually, all of those patients who are like that have that choice now. But regarding everyone else, like myself, I guess yourself, who would love to use data and trackers and technologies, and also physicians who are partners in this, so we can, as a medical team, make the best decisions, even preventive ones, for the sake of our health. We don't have that choice now. It's true that when we do have that choice, we will have anxiety, we will have more responsibility about that, because with more data comes more choices, a range of issues you have to face, and you will have to deal with those yourself. But as long as I'm the one deciding how much of this freedom of choice or how much of my privacy I'm willing to give up in exchange for a chance for a longer and healthier life, I should be all right. And that's right now we have to fight for the rights of these people because they don't have that chance in today's healthcare systems.
Yeah. Yeah, I think you're absolutely right. And personally, I believe, what I do for a living, I teach people how to use their minds. And I believe if you have one, you should know how to use it. And I, to some extent, believe the same is true of the body, that I think we should be teaching people how to maintain their bodies and how to take good care of themselves, among many other things that unfortunately we don't teach in basic education. But I do love that idea of, you have the right to not know.
But it's an amazing point. Just imagine that we learn about, the economy of countries and important historical milestones and all these subjects, but I don't remember learning extensively about how to take care of myself. And that's
right.
It should be a key component of everyone's life, that at least you know what you should do. It doesn't mean that you do it, but at least you should know, you have the knowledge, the basic knowledge about what health means and how we can keep it that way, or what to do when, something different happens. But that's just not part of any normal curriculum worldwide.
And it's mind-blowing how few people understand how their nutritional needs are being met, or how much sleep is enough, and what does it mean to get good sleep, and what's happening in my brain if I'm feeling down or depressed. And you and I geek out on these things. We enjoy learning these things, but I think everyone can benefit from learning them.
Exactly. And what do they do when they find out that, well, I would love to learn about these things? They go online and you do some searches, and what you find there, wow, it's a jungle of digital and health information. And without someone like an expert who can help you, like a good physician, like a primary care physician who is a partner in this, it's really easy to feel left out of this system and to be on your own with these range of decisions to be made. That's why I think data can help. So when I started bringing my genomic reports and microbiome reports and everything else to the primary care physician I had, well, I have now my third GP, and I found the one. She's excellent, and she told me that she became a primary care physician because patients like me, and she wants to have a good impact on my life for decades. And that's why she's a physician. And sometimes she said, she answered my question saying, I don't know, but you know what? Let's sit next to me and let's find out together. And that's the attitude now that we teach in my medical school at Semmelweis Medical School in Budapest, that it's okay for a physician to say, I don't know. You cannot know everything out there when there are 31 million medical studies and new technological innovations every day or so. So it's okay to say, I don't know, but you need to know about the methods through which you can find solutions. And with the patient, even by involving the patient, you can find solutions together, even building the relationship that you have with them.
Yes. Now, Bertalan, you've written 2 books that I know of. One, My Health Upgraded, Revolutionary Technologies to Bring a Healthier Future. And the second, The Guide to the Future of Medicine, Technology, and the Human Touch. You know perhaps more than anybody what's coming down the pipeline and what optimal health is going to look like when all of these technologies become available to the rest of us outside of the bleeding edge. What can we expect to see in 5 years, 10 years, and 20 years' time before we all board our spaceships to Mars?
I think that the kind of vision that we have about the future doesn't happen when these technologies become available, but when the cultural transformation that we call digital health finally takes place. So I'm trying to explain what I mean by that. A lot of people, even working in healthcare, decision makers, governments, think that 21st century technologies initiated changes in healthcare, and everything we see about the changing doctor-patient relationship, the patient empowerment movement, and so on, all these things take place because we have now advanced technologies. But we think that these changes were initiated by technologies, but are not driven by them. Because if we arm a hospital today with really state-of-the-art innovations, the best AI-based algorithm, the best smart sensors, everything that you can imagine that come out in the news every day or so, I guarantee that the quality of care would not get better, not even by today, not even by 3 months or 6 months, because people work in the system and we are slow in adopting these technological innovations. So we think that while we can't take technologies out of this discussion or conversation, we have to focus on ourselves to understand how we relate to these innovations. So if I tend to overhype a certain technology, or if there are technologies that make me fearful about the future, then I have to work on that and not the exact technology. Because the way we people in healthcare adopt or reject technologies, or the way we discuss their importance, these are just much more important things than which microchip comes out next year. So we at the Medical Futurist, that's what we work on all the time, to help policymakers, governments, medical associations, and patient organizations understand and acknowledge that this cultural transformation is the key. And if we can get through that, then adopting technologies with that knowledge is going to be a piece of cake. But if we focus on microchips and the next smartwatches, then we guarantee that we will see no changes, no significant changes in the healthcare systems worldwide. So answering your question, the vision we have is that patients are becoming the point of care, is that hospitals will remain similar to those that you see today, but their role is going to be different. When there's we have to use a big radiology machine that you cannot use at home, obviously you have to go to a place where they can do it, where they can scan you. But for most primary care health issues, for most health questions that patients have today, we think the initial line of primary care will be based around technologies. So it will be a luxury for you to be able to ask a simple question about your having a cold to a primary care physician, but you will first talk to a chatbot or some sort of an algorithm, because 5 million healthcare workers are missing worldwide, and we will never train as many as we need. So what we are trying to do is we are trying to build these visions by extrapolating from today's trends, as futurists do. We are also trying to understand the practical reality of healthcare, and coming from the eastern part of Hungary, seeing the really challenged regions helps me a lot in seeing reality compared to science fiction. And then we are trying to build or bridge these gaps between the two. So I'm not interested in the future 10, 15, 20 years from now. I'm interested in seeing a vision about the future of healthcare in 5 or 10 years, and then finding out today what's needed to get there. That's why we work with these organizations and governments, and we are trying to pressure them to make the right decisions for the benefits of patients. And in all this process, the most important stakeholder is the patient. And patients have been left out of all the major decisions in healthcare. And now the Food and Drug Administration in the US has a patient advisory board, and some pharma companies now appoint patient advisory boards. And we stress quite heavily for these medical organizations worldwide that without involving patients on the highest level of decision making, they can't possibly think that they can create or develop anything useful for them.
So fascinating. And, I admit I came into this conversation thinking we were going to talk about nanobots and DNA sequencing and all kinds of crazy stuff. But if I'm understanding you correctly, really what we need to be thinking about is how are we as a culture, and specifically we as patients, how are we learning about adopting, developing these technologies to work in synchronicity with our needs and our culture, so that it's not just another fancy technology that no one knows how to use and therefore doesn't actually make an impact on our lives.
Exactly. To provide a real-life example from my own experience for that, I could have my genome sequenced about a year ago. It was quite a fast service. Italian company did that. I received a comprehensive report, and as someone coming from genetics, I had a good eye on looking at the results and the interpretations, so I could see which parts are really useful clinically for me and which parts are not. But when I brought that to my primary care physician, who is supposed to be able to help me with that, the first one told me that he simply doesn't have the knowledge to do anything with the report, so I should not bring that report to him. I looked for another one. The second one said that even though he could try to learn some tricks and get some knowledge about this, he won't have the time. And even if he had the time, he couldn't upload any of this information into my medical records. Therefore, these useful piece of information that will affect the future of my health, like medication sensitivity, these points of information simply do not exist in my medical reality. So when I found the third physician, third GP I have now, she told me that she would try to upload parts of it into my medical record systems. She has some knowledge about that, but let's, as I mentioned before, let's find out together how this or that information could help us create a better preventive plan for myself. So while I had the technology already and it worked and everything went well, the cultural components were missing from me being able to enjoy the benefits of using that technology.
That's a great example. And that's even an example where all the regulatory stuff has been cleared out of the way so that you could actually even do that test. Imagine, when we get to nanobots and the regulation that's going to happen, the restrictions, the understandings, the education, the standardization to make it so that I can just, go and get an injection of whatever new technology is going to help me.
And it's even a bigger issue than it sounds. This is the part of the whole equation that makes me really worried about the future. When you saw when Mark Zuckerberg had the public hearing, we live our lives as digital geeks. So we know, we use social media and all the benefits of the internet, and seeing those policymakers not being able to ask normal questions, not even good ones, but just normal questions about how Facebook works, then how can you expect them to regulate nanorobots living in our bloodstream, artificial narrow intelligence algorithms supporting medical decisions, or mixed reality devices helping surgeons prepare for an operation? And while it's hard to expect that they would be able to do that, someone has to do it. Otherwise, we won't be able to use these technologies. So that's the biggest fear I have about digital health's future.
Yeah, no, you're absolutely right. I mean, I know for a fact the reason that the whole world is on the dietary plan, or most of the world, the Western world, is on the dietary plan that they're on, is because in the 1970s, the U.S. set up the McGovern Commission and got a bunch of representatives to sit on a commission and decide what was right for the average American to eat, and many other countries followed suit. And we ended up, eat as much sugar and carbohydrates as you want, stay away from fats, and, white bread is great, eat as much of it as you want. And look where we ended up.
Exactly.
So, Dr. Mesko, you have an audience here of many, many thousands of people who are enthusiastic and passionate about their health. Otherwise, I don't think they would have stuck with us for 260 episodes. What would you like for them to do going forward, to act on this information, to be part of this bleeding edge? I mean, what can we do, one, to feel superhuman, to reach the age of 100 plus on our feet, as you said, but also to help usher in this revolution of patient-led care?
Well, I don't want to sound like someone who is too romantic about the future, but I guess I am a bit. But what I would love everyone in the world say out loud, at least first acknowledge that they have a freedom of choice. So it's not that this is the healthcare that you receive and that's all. No, you have a range of choices to make when it comes to your diet, your health plan, your preventive plan, your treatment, your monitoring, and so on. And for those who are not into this, who don't want to quantify anything about them, who are just okay with going to a doctor when they have a symptom, I would love them to say out loud that it's fine for them if their lives depend on pure luck. I know it sounds like an aggressive sentence, but that's the case. If I get the right diagnosis in time, if they use the right tests, if the right information is obtained about me and so on, I might get cured or treated. If that's enough for them, that should be all right. For me, that's not enough. And to know that the lives of my loved ones depend on the same kind of pure luck, I'm just not okay with that. So I want to get involved and engaged as much as I can. I don't want to take the role of my medical professional, but I want to become an expert of my own health and disease management. And with that expertise and with their expertise about the medical profession, I truly believe that we together can make the best decisions for me, even if it's about a preventive plan or a treatment decision and so on. So this is the first thing I think everyone should do, to acknowledge that they have a range of choices to make. And then the way I started, I didn't first reached out to technologies, immediately, but instead at the age of 14, I realized that, it's a teenager part of your life. We have an emotional roller coaster every day, and I got quite fed up with that. So I thought that if I tried to quantify some parts of my life, I might be able to draw some conclusions from that. So at the age of 14, I started giving a score between 1 and 10 to my physical health, so how healthy I feel, to my emotional health, how happy I am, and to my cognitive health, how much I can focus and learn that day. And I've been doing that since then, so for 21 years, and not one day is missing. I know I sound like an obsessive person, because I am, but not one day is missing. And in 2 weeks, I learned my personal algorithm, which is, if I can exercise today, then I can learn, focus, just cognitively work better today and tomorrow. And if I can do that for a few days or a week, then my emotional health gets surprisingly better. That's my personal algorithm. And since then, of course, with a few gadgets and devices, I've been fine-tuning that model. Now I know that what kind of sleep quality I need and what I can do to make sure I get it 9 out of 10 times. I know what kind of mistakes I can do to go against it. My smart sleep alarm makes sure I wake up at the best time. And all these little tricks take me about 5 or 10 minutes a day. But I feel like I'm in control about many things in my health. And I don't even want to think about how many things I will never be in control in my life. And so these are the things that I can look at, I can measure data about, I can share with my primary care physician or my caregiver. And thus, I hope that we can make better decisions on the long term. So just by being curious about ourselves and looking into ourselves, find out what parts of our lives or lifestyle we should work on. And I don't see how someone can find this out without measuring any kind of data. I think that could be a very good second step forward.
That is one of the smartest things I've heard in a long time. I want to know more. Do you write this in a journal? Do you put this into a spreadsheet with other variables? How are you tracking data to get to the root of why you have either a 1 or why you have a 10?
I think you will laugh at me, because I reached out to the most ancient method. As a researcher, it comes from my blood. It's an Excel spreadsheet. For more than a decade now, I've had an Excel spreadsheet. I have a very simple system that I give scores to many things, like I mentioned before. But every year, I decide to work on some habits. So, for example, exactly a year ago, I started going to a professional chess trainer to become at least a semi-professional chess player in a few years, because I believe, I have a theory that the language of artificial intelligence is not a programming language as the programmer's language, but the language of AI is anticipation. And the best way to learn the skill of anticipation, not forecasting, is by playing a game where anticipation plays a huge role. So I had to choose between chess or Go. And as chess is more rational and strategy based, while Go is more emotional and intuition based, I had to choose. I chose chess. So every day I measure exactly how many minutes I spend time with learning chess or going to a chess trainer or playing chess. I quantify my sleep quality. It's very important for me to fall asleep. So before falling asleep, I want to read a paperback book, and it has to be paperback, not digital. I also quantify that. Of course, my weight. As a futurist, I have to dedicate enough time for forecasting and envisioning futuristic scenes. It's not that scientific. It's more like daydreaming. But based on the trends I learn and the studies I read every day, I have to be able to, break out of the cage of today's reality and and proactively think about futuristic scenarios. So I have to play with the what if question for 20, 30 minutes every day. It must be part of my job, even though, again, it's not a scientific method. It's just like great daydreaming. And I also try to measure how much time I spend in flow. I used meditation before. That also counts. But I have to be able to do nothing without any purpose, at least for 20 minutes a day, because that helps my mind to stay creative, not just in my job, but also in my everyday life. So depending on what habits I'm working on, I also quantify those. And I have I always grew up with video games. So I have these thresholds that I have to reach with these scores. And if it's above the threshold, like it's the 12th of December. If a score is above threshold, then it's a green one. If it's below, it's a red one. So I know which ones I should focus on. I guess describing this in that many details, it might sound like this is an obsessive and time-consuming behavior, but
Nope.
it's really not. It's like 5 minutes a day, but I think I know what I have to focus on. I know which things or which types of hobbies make me have a happier life or just feel myself.
Yep. No, you found the right audience here because I track absolutely everything that's happening on all my digital devices. So I was able, I use a tool called Rescue Time to automate a lot of it, but I was able to look back and compare. We're now recording in the end of 2019. And I said, okay, in 2018, I felt like I was on Slack too much. Exactly how many minutes did I spend on Slack in 2019? And did I reduce it by enough, or do I need to work on it more? I spent a total of, I think it was 78 hours on email the entire year, which I'm very, very proud of. So I track these things. What I like is at the end of the day, you're looking at this spreadsheet and you're going, okay, let's just say I'm feeling particularly ecstatic, happy, energized, motivated. And you can look at the spreadsheet and go, oh, of course, because I worked out for 45 minutes a day this week and I slept better, and you can just see the proof in the pudding. I love that.
It also, there's another segment to it. If I do functional training mostly, and when I know that if I will have 60 minutes for that today, but if I could just stay out for 15 more, then my average would get above the threshold. So it will be green for at least a day or two. And that's
smart.
Motivation big enough for me to stay out. I mean, if that's the only purpose why I'm using this spreadsheet to sometimes stay out for 15 minutes more, I'm still okay with that. But this one helps me so much in seeing my life on the long term, to be able to zoom in and zoom out. I just zoomed out yesterday. I just checked some of my data, and it turns out that I spent 900 hours playing chess and learning chess this year, which
that's fantastic.
It's a frightening number, having a little kid at home and having a family life and traveling to give speeches. But I know that that's dedicated I am to become a good chess player and to understand the language of AI better. So looking back at this comes with a bit of anxiety, but also I have to be proud, because when I made that decision to go into it, I haven't given up, and I'm not even planning to do that. I have been dedicated to that for over a year now. So, let's keep on doing that in 2020 as well.
I really love this idea. I'm tempted to ask you if you would send me a blank version without the data so that I could use it as inspiration for 2020.
Of course. I published the blank. I will send you the link.
Oh, wow.
Where I've described all these details and what I've learned over the last year. And I also published a blank Excel, but it's really simple black sheet with a few,
that's fantastic.
macros
and I
inside,
should
but
introduce you, if you don't already know Cedric Waldberger, I should introduce the two of you, because he tracks every waking minute of his life. He's built shortcuts on his Apple Watch and iPhone that he can just tag every minute and see how his time is being spent. And I think you two would really geek out together. He's also in the futurism space.
It sounds great.
Now, I also want to ask, I would be remiss, because you are at the intersection of technology and medicine, I'd very much be remiss if I didn't ask you what tools you are using. You mentioned you use a sleep tracker. I want to know which one. What are you using to track your workouts? What devices do you like? What services are you using to do genetic testing? I would love nothing more than if you'd share, like, what are the tools, given your vantage point and how much knowledge you bring to the table, which are the devices and services that you just can't live without?
Of course, I would be happy to. I have to know that I've tested over 150 digital health sensors, and I have no stock in either of those companies, unfortunately. But if I love something, I say out loud. That's why I'm an independent researcher. The Fitbit Ionic is the smartwatch I've been using for more than 2 years now, and that's the smartwatch I've used for the longest time ever, and I've used many. I use that mainly for just basic fitness tracking every day, but there is a smart sleep alarm function that was introduced last year, and since then I've been tracking sleep with different sensors, but now I can use my Fitbit Ionic to provide me with the smart sleep sensor, and that's just perfect. For fitness tracking, when I exercise, I use a Polar chest strap, which provides a really detailed analysis about really everything, every aspect about my functional training sessions. So I use that one. I tried to measure stress before with a device called PIP, P-I-P, but it turns out when I measure stress, it gets twice as high. So I thought I should not focus on that one so much. I use the Atlas Biomed for a good basic genetic testing service. And I also use them for microbiome service. So I still receive recommendations about the types of food I should consume week by week based on the content of my microbiome. I use the Headspace app if I want to meditate properly and on purpose. I use a game called Elevate for cognitive training. I know that cognitive training apps have not been shown by scientific studies to be that useful in improving any skills or memory, but I still find them very useful in my personal life. I use, like once a month, I do an ECG measurement with the device called Cardia, because Cardia has the highest number of medical studies in the background. So they have pretty good evidence behind them. And I count calories on MyFitnessPal, the application.
Yep.
I think these are the basic apps and devices I use. I've tested many, but I stopped using them after a while because I saw no reason in, keeping using them.
I'm the same way. I get a lot of really cool devices sent to me in the mail, and I'd say I end up using less than 20% of them, and I end up recommending less than 10% of them.
The one rule I have for apps is that I receive 0 notifications on my smartphone. Only a telephone call and a text message can come through, but literally nothing else, not even Messenger, Gmail, nothing. So when I dedicate time to that, I sit down and do work. But otherwise, I don't want to be, interrupted all the time by these messages, because the fear of missing out, the way Harari described in his book, Homo Deus, I found that to be perfectly represented in my life, and I felt very sorry for myself about that. So I just don't want to feel the fear of missing out, and I don't want to be engaged all the time. Plus, if I get engaged all the time and I get many questions online, so if I just answer questions, I could spend 8 hours a day with that, and it would be great because I love that, but still, I would never have the chance to just, freely contemplate about life and think about things, envision futuristic scenarios, or just play with the what if question, because my original story, or my origin story, comes from science fiction. I've been a science fiction geek for my whole life. I've watched I think over 1,000 science fiction movies. I read a science fiction book, I think at least 3 or 4 times a week, and sci-fi is my basic resource for inspiration. So I need to keep on playing with the what if question as a part of my job too.
Fantastic. Now, on the topic of books, are there any books that you would love for members of the audience to read?
Wow. Of course. I mean, I can't say I would love them to read that, but if they want to have a certain experience, then it would make sense to read those. I think the best book in recent times in science fiction was Ready Player One. Not the movie, strictly, not the movie, but the book. The book is, I almost missed a flight because of that bloody book. because that's how perfect it is. I was born in 84. Therefore, what the time the book describes is just perfect for me, and I understood every tiny detail of it. But my all-time favorite is obviously 2001: A Space Odyssey. In that case, both the book and the movie, obviously, but the book is also an amazing resource. Maybe these are the two ones that I would love everyone in the world to read at least once in their lives. Plus, the science fiction book that put me on the path of becoming a science fiction geek was Solaris from Stanislav Lem, I think about 25 years ago. So the Solaris is still, I think, the mother of all science fiction books.
Wow, that's great. And for anyone listening, we're going to put all those in the blog post, as well as all the recommended medical devices and services. Bertalan, I want to thank you so much for coming on the show. But before I let you go, I do want to ask the last question I always ask, which is, if people take away one big message from this podcast episode and they carry it with them for the rest of their lives, what would you hope for that to be?
That there is hope. That the way someone comes across a healthcare system and the way they receive care, or the way they keep themselves healthy for a long time before receiving care, I know that it's tricky and it's not innovative, and the way we live our lives through these gadgets, you don't come across those science fiction-like things at the point of care. But there is hope that with the advancement, with the introduction of technologies, and through the cultural change that we see, that we call digital health, it's going to be all right. We will feel like being cared for in a science fiction movie, like how physicians could use medical tricoders from Star Trek, or how we could use radiology machines like the ones in Elysium that could just kill cancer cells in an instant. There is hope that healthcare will be like that.
I'm so glad to hear you say it, and I look forward to it, and I look forward to hanging out potentially on Mars.
Thanks for tuning in to the award-winning Superhuman Academy podcast. For more great skills and strategies, or for links to any of the resources mentioned in this episode, visit superhuman.blog. While you're at it, please take a moment to share this episode with a friend and leave us a review on iTunes. We'll see you next week.